Hey, thanks for tuning in today. This is Autoimmune Health Solutions. I'm Anthony Sana, and
I'm Dr. Michael Smith.
we are doing a bit of an impromptu session here today. Michael and I sat down today to record a podcast, another episode of Autoimmune Health Solutions, and we decided to talk about something really hot and timely, the coronavirus. So I guess this episode, the coronavirus and autoimmune disease. Can we say that, Michael?
Yeah, that'd be good. I was actually going to record this later today, but I had my notes with me, and since we're recording anyway, I thought we could just record it now and help people make sure they're going to know what they need to know, do what they need to do to avoid getting what we now call the coronavirus.
Right. Well, let's get right into it. I mean, I'm sure there's some people who may live under rocks out there, and they might not even know what the coronavirus is, or they're avoiding liquor stores because they don't want to get the coronavirus.
Oh yeah, I forgot about that.
You've seen that, eh? So what is the coronavirus?
So it's an airborne virus, like many other viruses. It sits between your kind of standard flu virus, your swine flu virus, and things that are more scary like SARS. So it has the same it's the same kind of pathogen as a standard seasonal flu. It's just a bit sneaky, and because of the way it's sneaky, it's causing a lot more people to show up sick in larger groups unexpectedly. So prevention is really important. Panicking is not important. Doing your best to make sure that you're keeping your immune system adaptable and strong is important, and we're going to get into all that. But yeah, please don't panic. It's not anywhere near that at this point. But we do want to make sure we understand how to prevent spreading it in detail, and then what we can actually do specifically once we understand it a bit more to prevent it.
Well, the idea of preventing it, I think, is of utmost importance here. But I mean, I've got a curiosity first before we even get into that. Like, how does it even compare to things like what's happened in the past, things like SARS or the Norwalk virus, or I don't know, even like the common flu?
So that's a really great question, because the more you can have a perspective on how relatively dangerous or undangerous the coronavirus is to other pathogens, I think we're going to all be able to relax a bit. So when you look at the last big outbreak that we had, which was the Sars virus, it had a mortality rate of 10%. So if you got really sick and ended up in the hospital and you ended up with acute respiratory distress syndrome, which is usually what the flu turns into, only 10% of people actually died. And when you look at the previous big influenza that we had, which was called MERS, which is Middle Eastern Respiratory Syndrome, it had a scary 34% death rate or mortality rate. When you look at the numbers we have right now, and we'll go more into detail with those later, at present, the coronavirus has only got a 2% mortality rate or death rate.
And so how does that compare to like the common flu?
So the common flu has about a 0.1 or 0.01%. So that makes presently the Wuhan virus about 200 times more dangerous.
Right.
But it's 1/5 of as dangerous as SARS, and I don't know, I guess 1/15 of how dangerous MERS was. So we're looking at something that at this point anyway isn't that dangerous.
Wow. Okay. Well, it's just, you know, what we see in the media and on social media, that sort of thing, that sort of makes it that much more ominous, I suppose. It's good to have those numbers there. So that said, it's more troublesome, dangerous, life-threatening. Can I say all that than the common flu?
By 200 times, yeah.
Right.
Again, it's only 2% of people who get this that actually end up sick enough to die of that acute respiratory distress.
Right. Right. Okay. Well, if it is that serious, what is it that people should be doing with, I guess, prevention or avoiding it, or what's the right way to address that?
Well, standard flu prevention procedure is to wash your hands, preferably with some kind of alcohol, antibacterial. You want to make sure that you're keeping your home clean, your bathroom clean, your kitchen clean. If you go to the gym, you want to wipe everything down even more. It's a really good idea to avoid anyone who seems like they have any kind of flu, any kind of cough, sniffle, anything like that. If you're a person who has a cough or a flu or a fever, stay home. Depending on where you live, the local government will probably have it set up for a specific kind of ambulance to come and get you if you do believe you're in, actually a person with the coronavirus. Because of the nature of this virus, the most important thing to focus on is prevention. So that's the key. There is some concern around open markets and raw, uncooked animal flesh, but you don't want to be eating raw food. You don't want to be eating a lot of leftover food, anything that could potentiate any other kind of virus. I think the other thing that most people do when they're trying to prevent the spreading of the flu is if you do feel that you're a person who's prone to coughing for other reasons, or you sneeze a lot for other reasons, people who sometimes spit for a lot of reasons, that's something you just want to get into the habit of keeping very close. So if you're going to cough, cover your face with your elbow, with something like that. If you're sneezing, try and use something that's more like a handkerchief or something like that. If you're going to spit, again, put it into something so it's not getting all over the place, because that's how these things spread. They spread more obviously with closer contact. I think the number on average is about 6 to 8 feet for airborne contact. So if you are sneezing, try and make sure you're doing that at least like 8 to 10 feet away from people. But that's just our standard, ways to prevent the flu. There's a lot of people running around getting masks right now, and that's not actually that effective unless you're a person who's familiar with using a mask to avoid some kind of pandemic. Because imagine that I've got like a kind of a drywall mask on, or the typical kind of like cheap surgical mask, and I'm breathing through it, and if I have, say, the coronavirus and I don't know, or people around me have it and I can't tell, how I remove that mask has more to do with how it spreads than anything. Right?
So you're saying somebody could be taking something that's infected and just sort of, as you were describing, I'm going to go sneezing all over the place with it?
Well, if I had a mask over my mouth and then I go to grab the mask off of my face and it's covered in other people's sneezes and things, I just put those sneezes on my fingers, and then I went to hug my kid or make supper or whatever. So if you are feeling that it makes sense to you, and this is up to you, that you want to use a mask, get a mask that's got a rating of N95. They're much clearer fitting. They have much better filtration. And or if you can't get a really good mask, make sure that when you when you take the mask off, especially, you wear surgical gloves or some kind of disposable gloves.
And I would say that you probably need to change the mask often, or dispose of it properly, or something.
Well, yeah, that's what I'm speaking of, is disposal. Because I mean, it does have some mild, support for keeping things from spreading, but it only works if you maintain a kind of contagion relationship with the mask all the time. So once you put it on, you're either preventing other people from what you get, or you're preventing you from getting what other people have. So every time you touch it, every time you touch your face and don't recognize it, if you have an itchy nose and you rub it the way you usually do, that's how wearing a mask actually can make this worse. So if you're not what you might call mask aware, then you might want to just avoid it, because you're going to be more, what's the word? You're just going to be less aware that you're more contagious than you think you are. There is concern around people with pets at home, people who work in pet stores and stuff. And again, you just need to be more vigilant, more alert, wipe everything down, be called a 3-week short-term hypochondriac around that. Although there is no evidence you're going to get this from your puppy or your kitty cat, it is a really good time to just be very mindful that we haven't got this completely figured out yet. And the more careful we are, the better. But at present, we have no evidence that anyone has caught this from a living cat or dog.
We talked about this being a conversation as it relates to autoimmune disease. I mean, that's the whole focus of our podcast. How does it relate?
Well, when you look at the people who actually get sick and then get the sickest, it's usually people who are aged, typically over 70 is kind of what we mean clinically by that. It also has to do with how compromised your immune system is. And people with an autoimmune condition, obviously, their primary concern is the function of their immune system. Now, that can go in two directions. You can have a hyperimmune system or a hypoimmune system. Hyper meaning it's going to overreact, and that may speed up the rate at which your symptoms happen, which is actually a good thing. But if you're hypoimmune, that's going to slow down your immune system's front line and trying to basically push the virus away or fight against it in some way. So people with low immunity are the people who are more likely to spread it. And more importantly, they have about 5 times the death rate in the hospital. So we'll get into those stats later, but people who are chronically ill, especially with immune system dysfunction, have to be really, really careful.
Well, it just sounds like it's something that, what's the word, has the potential for being huge or bigger than it already is. But I've read different things in the papers online as well, talking about the numbers and statistics. Do you have any sort of real numbers behind what actually is going on?
Okay. I'll come back to that in just a sec, because there is one other thing that, especially for autoimmune patients, is important. And if you're not familiar with my work, I've been working as a clinician for 25 years, focusing primarily on autoimmune disease. So I'm very familiar with that population of patients and how the drift of statistics is more specific with that population. So the biggest concern I have actually in with my patients in my community is people who are just coming over a big flare-up of a condition, especially an autoimmune condition, because your immune system is actually kind of changing gears. You could say that would be similar if a person had just come out of a surgery, a really extreme antibiotic protocol. So if you've just had a recent flare-up or you've been through any of those things, it's for about a month after that you're more susceptible to viruses if they're going around. And given how this one moves, that makes you not only more susceptible of getting it yourself, but more dangerously, that makes it more likely you can spread it around unknowingly.
Hmm.
So to come back to the math or the statistics, right now, as of February the 2nd, I think that's the date today. The last time I checked the World Health Organization portal for this, there's just under 15,000 people worldwide with this. I think that's about 3 or 4 people in Canada as of today. It's almost exclusively in Asia, almost, in the sense of that number. And of the 15,000 people, only 304 or 5 have passed clinically from this condition, as far as we know, in that time. So if you take 300 out of 15,000, you're back to that 2% mortality rate. However, that's the average of people that we know who got it, and then eventually ended up in the hospital, and then eventually ended up sick enough that they ended up being treated for it, and then the treatment didn't work, and then they passed away. That's 3 or 4 different, call them off ramps for most people. So 98% of people will fight it off peripherally, or they'll be able to treat it, just by general support and isolation and things, by staying at home or ending up in a kind of a locked room in the hospital for a while. However, if it goes really deep, really fast for its own reasons, or because you already have an illness that lets that happen, that's when the actual death rate gets scary, because it's up to 15%, which is over SARS. But we all know that hospitals are full of sick people, and I'm not saying that to just be funny. But the people in hospitals who are already their immune systems are quite destroyed by the process they're already in. They're the people who usually have the shortest period of time from getting the virus to showing symptoms to dying if they're going to. And again, that's 15% of the oldest, sickest population that are already ill, and most of them already in a hospital. When you look at the numbers of people who are young and healthy and fit, who are not in the hospital, who have not had any kind of recent treatment or anything else, it's lower than 1%. So this is where the fun thing with averages are. So this brings up the really important numbers. Your typical flu is going to set off symptoms in about 3, 4, 5 days, depending. This one usually sets off symptoms around 4, 5, 6 days, which may not seem like a huge difference, but that's just more hours for people to not know that they have it. Now, the other thing that makes the novel coronavirus or the Wuhan virus so tricky is symptoms are really, really slow to progress. So you could actually have this for 10, 12, 14 days before your symptoms start to get fever, really respiratory symptoms that tell you, oh my God, I'm actually sick of something. And that's where the math gets tricky. If you've ever seen a pandemic movie, and I'm sure we've all seen probably more than we need to, it's always that person going into an airport and then sneezing on an airplane and then going to another airport and then going to a hotel and a restaurant and whatever. And it's usually in that one day that we see in the movie that person is infected, 30 people, and then that's 30 times 30 more people. Imagine that person walking around a new airport every day for 2 weeks, traveling salesman or whoever your, ideal airport visiting person would be. That's what's getting everyone in the international medical community concerned, because it's more of a ticking time bomb than an avalanche. And again, that's why my focus in speaking to people about this is focus on preventing this from spreading by pretending, if you can, that whatever you're carrying in your body as a virus, even if it has nothing to do with this, it's now your job for 3 weeks to make sure no one gets what you're carrying. Because if you can do all of the things from hand washing to whether or not you're going to use a mask, rubber gloves, don't forget, and some of the kind of what we call clinical hacks that I would recommend anyone consider to prevent this, just in the common sense of flu prevention, that is good steps to protect you. And, we're that kind of a society where like, oh no, what about me and my friends? Instead of what can we all do to make sure all the old people with chronic illnesses and autoimmune diseases don't get it? Because they're more likely to get it and die. And they're the ones that are more likely to be around a lot of other people who are going to get it and die. So if you're young and fit, do the heroic thing, whatever that seems appropriate to you, and pretend for at least 3 weeks, at least in your community, if you're not traveling, your job is not to spread any bugs at all. Because again, it's got that 2-week window of actually really presenting hospital patients, right? So until your town, city, or community has people in the hospital acknowledged as actually having the novel coronavirus, then you don't know for sure that that's even in your community. And instead of waiting until that day going, oh, well, now I should be careful, that's 2 weeks later than you should have been careful. So if we're going to take this challenge, as an international community of people trying to stop it from spreading, pretend you have something you're trying not to spread by being super careful. Stay at home if you feel sick. Wash everything, wipe everything down, eat fresh, healthy food, take care of your basics, hygiene and sleep and stress. And it's funny that this has come along because it's such a low probability of death rate, but such a sneaky probability of showing up anywhere. Right? And it's the sneaky probability that has people scared, not the death rate. So don't panic, just be practical. Right? Be preventative, be conscious, be a hero.
Be a corona hero. I'm curious, and I'm not sure if you have these numbers at the top of your head, but if we were to compare the way things are panning out with the coronavirus, how would that compare to, say, what happened with SARS? I guess maybe the real question is, did SARS go away? Did we find a cure for that?
No, SARS is still around. I checked on the portal today for the Middle Eastern Respiratory Syndrome, and there was 2 active cases in the Middle East as of today. So these things are viruses. Viruses are mutagenic, and that means that they keep changing, which is why every year there's a new flu vaccine, because we're trying to prevent the new mutation of the flu. And that's also the biggest concern that the international health community has with the novel coronavirus is we don't know if it's going to switch from 2% to like 20% at some point. So all we can do is basically say what I'm saying is be the hero of prevention and don't let anything that's crawling on you or in you get anywhere. Sorry if that was ooh, ick, but imagery helps people think about this stuff.
Yeah, that might actually motivate them to actually do something. Certainly a lot more to cover with this, I think, than we have time for today. Is there anything else that you wanted to address that you haven't talked about already?
Well, the thing is, being practical. So many years ago, I was friends with a doctor who worked with Doctors Without Borders, and they went for about 6 months of the year into hot zones, places where there may be pandemic or really bad hygiene, war and strife and malnutrition. So places that are called hot zones because that's where viruses spread the fastest. And this is what they recommended to me. And I've done it every flu season since. It's called the DC oil protocol. Now, to be clear, I am not recommending this as clinical advice. I'm sharing this as research that a lot of clinicians use. So I just want to be clear for the lawyers out there. If you take some vitamin D, vitamin C, and a really good anti-inflammatory omega-3 oil, say like krill oil, cod liver oil, or something like that, 3 times a day, you're going to basically upregulate what are called antiviral peptides. And it's those antiviral peptides that actually stop the viruses from getting past the initial mucous membrane of your immune system, if they can. So the doses for most adults would be 1,000 international units of D3, 1,000 milligrams of vitamin C, and 1,000 milligrams of your favorite fish oil. And you take those 3 times a day to keep the front line of your immune system stronger. Now, that's not a clinical protocol. It's not something that the World Health Organization is going to sign off of, but it's something that doctors who travel internationally into hot zones will typically do to just keep themselves a little bit more protected. If you're trying to make sure that your upper respiratory tract has less pathogens in it, there's other protocols. One is to use oil of oregano. Now, if you take oil of oregano and put it under your tongue and swash it around your mouth, you may or may not actually set off a worsening infection depending on the health of your teeth and gums. So what's clinically recommended, at least in my experience, especially for people with an autoimmune condition, because that's really who we're talking to, you take a scoop of coconut oil, a little tiny scoop, put it in something and warm it up, add a few drops of your oregano oil, and then pour all of that into a cup of water so the oils are floating on top. Put that cup of water in your freezer, and once it turns into a solid little nugget of hard saturated fat, then you can swallow that, and that allows the oil of oregano to actually deal with the feasting microorganisms right below your stomach acid, which is where most of these pathogens really get started from internally. But those are also the things that on the front line make most people make most people's immune systems more under distress. So if you're trying to I just had this idea of cleaning out your car. So if you want to clean out your car to make sure that the viruses drive by and think, oh, that's a really clean car, don't go there, that oil of oregano protocol is a really good idea.
So I need to put oregano in my car and freeze my car. Got it. Before, I'm just joking with you there, of course, but before you carry on with that, the initial protocol that you mentioned with the D3 and
DC oil.
DC oil, thank you. That's what I was looking for. How long should you actually take that, or can you take it ongoing anyways?
I usually do that for about 2 months at the beginning of flu season. So once, here in Canada, it's get cold enough that things are frozen in the morning, then I just bring that out. And I'm also an autoimmune patient, so usually I'm just really careful about that because my job is to go to work and see sick people, right?
Right.
So that's my standard flu prevention, and I rarely ever get sick in flu season. So that's a good one. There's a Chinese medicine one. It's not specific for flus, but if you do feel like you're getting a chill and you're having a hard time warming up and you're feeling like you might be getting something, you can simply mix a few, say 3 green onions, just the white part chopped up, a good thumb-sized chunk of ginger chopped up, boil it and make tea, add a little bit of unpasteurized honey into a nice big bowl so you have a good amount. Wrap yourself up in a blanket, drink the whole bowl of ginger soup, ginger onion soup, and wait till you sweat a little bit. And that can help clear things out, because we want to make sure your peripheral immune system is active and good at kicking things out. And that brings up things like saunas and intermittent or alternative heat showers where you're going hot to cold back and forth. That can also sort of challenge your immune system in a way that makes it more likely to protect you from things on the front line. There are some really specific Chinese herbs that we use to prevent this, but in this situation, you would want to take that standard kind of preventative Chinese medicine, which I'm not going to mention because it'll cause a run on something that May or may not be the perfect idea. But if you work with an acupuncturist, a Chinese doctor who is really comfortable with herbs, make sure you're getting the preventative herbs with the one that's the most specific for where you're the most likely to have low-grade infections. So that might be your chest, it might be your gut, it might be another mucous membrane like your eyes or your ears. If you're a parent with kids, watch for ear infections and nose infections, because what we're really trying to do more than anything in the long term is avoid viral load. We're all covered in bugs and critters. I know it's icky to think about. So we all have a viral load. So at this point, the best thing we can do is reduce our viral load, increase those antiviral peptides with the DC oil protocol, kill off anything running around with the oil of oregano, and see your clinician who knows about medicinal herbs to make sure that they're reducing your viral load practically, and then decide for the next 3 weeks at least, we're all going to be the heroic people who are focused on preventing this from spreading, because anything else is just waiting to see how bad this gets.
Corona heroes, here we come.
Yay.
Yay. Wow. That's a ton of great advice and ideas there, Michael.
Great. Now I don't have to film this later. Woo! I love to be efficient.
there we go. I was just going to suggest to people that if they want to tune in, certainly this is going to go up on Facebook. So questions, they can go there.
Yeah. Please put a question, because it'll be on the page, so I'll get a notification and be able to answer you.
Yep. Questions can go there. Autoimmunehealthsolutions.ca is the website.
.com.
I stand corrected. I'm a proud Canadian here. I want to make it the .ca.
We all want to be heroes, Anthony. It's Hero Day.
Yeah, I just want to be typo free is what I want to be. Read my own writing here. .com. Autoimmunehealthsolutions.com is the website to go to find out more about whatever it is that Michael.
Yeah, I'll probably put a blog post up on this in the next couple of days so people can see the stats, the numbers, and the protocols in black and white.
Yeah, plus a ton of other great information about other things related to autoimmune disease, right. Not necessarily the coronavirus.
Yep.
I think that's a wrap for today.
Yeah. So everyone, it's February the 2nd today, 2020. For, let's say, outside of Valentine's Day, let's all be a little bit stoic and at a distance from each other and preventative heroes. As close to the end of the month as you can make it, because until we figure this one out, it's the sneaky, slow, silent one that's gonna creep up on us if we're not careful. So be careful, but don't be crazy. Don't panic. Be practical.
Great advice. Great conversation today, Michael. Thanks
for helping me out, Anthony. And I hope this helps people make sure they're sane and calm and healthy and, well, not freaking out.
Good call.
There's a lot of people freaking out.
Don't freak out. Be a hero.